Nadaljujemo pa z gostom iz Češke, agronomom, raziskovalcem, dr. František Bednarik, ki nam bo povedal še kaj več o uporabi konoplje tudi pri zdravljenju živali.
Currently, the cannabis with high THC content is used, but the THC content in the plant limits both the quantity of patients and effectiveness of therapy itself. To be able to give the patients a really curative dose of cannabinoids, it is necessary to deliver the approximately from 3 to 4 times high quantity of cannabis than it is used currently. That is why it was necessary to find a way to increase the dose of cannabinoids, but simultaneously with to decrease the THC quantity so that the patient is not influenced mentally in any way. We work by cannabis which contains 0.3% only of THC. Okay. There was an idea at the beginning. The idea help with a similarly miring health problem obstipation. I started to compound the recipe for influencing the large intestine microflora in colon. This was based on two principal reasons. It is well known that the second biggest quantity of nerve connection in human body is located in the colon epithelium. The first is in the brain, of course. Sorry. Is also well known that the colon is responsible for immune system of organism in crucial way. Immune system failure is then the cause of number of autoimmune diseases. It results from it that the whole range of results can be achieved by influencing the processes in the alimentary tract of the organism. The elementary problem of correct biochemical processes in the colon is microbial stage of its connect. This microbial structure is influenced by the structure of food, life, styles, medications. It is well known that the lactobacilli are very important for the correct function of the colon. This bacteria influenced by their metabolism on one hand other species of microorganisms. On the other hand, they interact the self of colon epithelium, biochemical. Butyric acid ester is very important for healthy the cells of colon. And butyric acid ester arises during the metabolism of cellulose by effectivity of lactobacillus in anaerobic environment. Butyric acid ester is able to kill the microorganism causing the inflammation of colon epithelium. But we talk another way. By this, we reportable development of lactic acid bacteria by delivering nutrition insoluble fiber to these bacteria. And at the same time, we used this fiber as a carrier of hydrolactic substances gained from medic plants. In this way, we managed to get both lactophilic cannabinoids and hydrolytic substances into one blend. We ourselves did not inspect the effects of these blends to have such a wide spectrum of incidence on organism. Posuňme nahoru. Yeah. In the chase for one chemically clean substance at the cannabis CBD and CBG, the remedial substances and as waste. And this is just due to the reason we don't know work with them. The use of other kinds of medical plants, medicine plants, in the blend together with cannabis has synergical effect. Linking sometimes unrelated partial results to one, the principle brings new possibilities. And this combination of substances has turned out to be very effective the whole range of health problems. There is also then an addition of further medical plants in preparation cannabis to increase of curative effect. Cannabis contains 0.02 milligrams THC milligram per gram. Daily dose for the patient is 2 milligram THC only. We have the patents for the combination of some cannabis and medicinal plants blends for certain diagnoses. The way of progressing of cannabis is in the preparation called cannabis is different from technology used by now. Although the way of preparation of medicinal plants is different from the state of art used by now. Můžeme posunout. We are able to walk by cannabis at beginning of this problem. So based on the scheme problem, už jsem další. Můžeme další. Jo, tak. There were different kind of effects of Renesansa at the patients with this diagnosis depending on the age and sex. The glycemia values can be seen in the chart. The glycemia regress was the most significant at the older pensioners women. We noting the more significant changes in glycemia at the older patient women. The effectiveness of the therapy was more significant at these patients with an increased age. Currently, we are proving the hypothesis what this epidemic is caused by. The excellent results have been achieved, and the patients with the diagnosis colitis ulcerosa by 2 types of patients are distinguished at this diagnosis. These are young people at age of 16 to 20 years, people of sport very often. They were treated with corticoids repeatedly in the past, but the illness came back in the course of time. They suffered from the problems with digestive. The and more numerous group of patients are the ones at the age of 50 and more. The disease is chronic at these patients very often. They take cures on a long-term basis to reduce the symptoms of disease. There is a patient at the age of 64 on the slide. She have been suffering from colitis since she was 35. Sorry. The disease is chronic. She has worn nappies since the ages of 58. The patient is checked up by her doctor after 2 months. She doesn't suffer from diarrhea anymore. She doesn't have to wear nappies anymore after more than 6 years. Her husband is pleased that she can help him with the work in garden. No. Jedeme dál. My tam potřebujeme rakovinu kůže. Rakovinu kůže. Cancer skin. Jo, je tam. Jo. You can see the status of patient with diagnosis of skin cancer. The patient was irradiated on a specialized oncology working station. On the slides, you can see the ranges of bindings that the patient suffered during this type of therapy. After the transportation for the aftercare, the patient was treated against the pain by application of opium derivatives. After 14 days, the skin defects of big regions occurred. Defective skin was inflamed and it stank. The patient was complaining on the burning pain. The skin on the belly pain him. He even stopped eat. Můžeme dát další? Tak. In the case of this patient, the complex therapy was started and it both therapy in the form of balsams made of cannabis and interned in the form of Renesansa. The pain receded after 2 hours. The patient started ingesting again after 2 days of therapy. There was a worry if the abstinence symptoms would develop at the patient after the interruption of serving the morphine derivative. This appearance did not evidence itself in almost any way at the patient. He was only sleeping badly for 3 days. You can see progress of therapy of skin defects on further slides. After 2 weeks, 4 weeks. The attending physician stated an excellent result of therapy after 3 weeks on therapy in home later. Jdem další. Jdeme na prst. The use of cannabis preparation at the patients with DM2 during the surgery major. The patient, man at the age of 63 years, the amp of type 2 has been diagnosed for 8 years. In 2012, a 2 on leg was amputated the patient. The recovering process after the operation took 2 months. In 2016, this patient was ordered to an amputation of second toe. The cannabis preparation was implanted a week before the operation. The healing of the wound was so intensive that the patient was discharged from the hospital already after 3 days. When check up after a week, it is 10 days after the operation, the wound was healing completely. I emphasize that this patient did not have any other medication after the operation, even not one against the pain. Just to compare, another patient with DM of type 2 who toe was amputated on the same day was hospitalized in the hospital for other 50 days. Next. Vozík. Sclerosa multiplex. This lady has been suffering from the diagnosis of multiple sclerosis since the age of 30. At the age of 53 years, without the possibility of the further therapy. She was treated by corticosteroids repeatedly. She has been bound on the wheelchairs since the age of 33. Besides the both legs, the right hand and also the majority part of the left hand of the patient are paralyzed. The patient was suffering from obstipation too. During this status, we starting applying the preparation Canasan to the patient internally. After 3 days, the patient started having stool once a day regularly. Serving the cannabis preparation helped the patient in a very significant way, the obstipation being removed. During the continuation of the therapy of obstipation, the unforeseen by effect occurred the patient, but these effects were expressively positive. In May, after 2 months, the patient started informing that her legs and posterior hurt. In June, the patient started to move with her left hand in a more active way. The stenting. Staff can see, which is a more satisfied expression in the patient's face. The head of the patient on the wheelchair started to be erective, was not droopy. In August, so after 6 months, the patient manages to raise the legs for 15 centimeters from the ground floor. I informed her neurologist on this status. The patient was hospitalized in a military medical institution, and intensive physiotherapy was started at her. Since January 2017, it means after 10 months of therapy, the patient has been able to pedal a stationary bicycle for a time of 15 to 20 minutes. In March 2017, the patient manages to pedal the stationary bicycle for 1 hour and a half already, and she carves 20 kilometers. At the present time, the lady manages to cook, wash up the dishes, put the washing into the washing machine, hang up the washing on dryer, and similar kinds of simple housework. Pustíme video. Jo, je to tam. She was totally immobile, paralyzed.
Vůbec jste nepohla rukou? Vůbec?
Ne, to ne.
A teď s ní můžete hýbat jak?
Zvuk?
Tak teď to dělám tak, že tady to mám za pravou a tady to za levou, že to přidržuju a tady to udělám.
Aha.
To jsem vůbec nemohla dělat.
A co jste mohla dělat? Jenom takhle mít ruce v klíně pořád?
Jo, no
ano?
levou.
Aha, pravou, ano. No. Jenom držet v klíně?
Takhle nohy, to jsem vůbec nima nepohnula.
Ano.
Tady s těma nohama.
Vůbec, a teď je narovnáte vysloveně.
No teď jako se melou, ale teď míň, protože jak je teplo, taky mám oteklý.
Ano.
Jako je to lepší o mnoho.
Aha.
To o mnoho lepší.
A kdybyste si nepomáhala tou levou rukou, tak s tou pravou rukou děláte aspoň něco? Nějaký pohyb?
No tak jako si třeba vemu nůž do ruky a uříznu.
Další video. Next video.
Teď.
Ne, teď.
Ten palec může ruku.
Ne, Tomáš.
Teď.
Ne, teď.
Ten palec může ruku zvednout.
Ale zvedni.
Sorry. Jo. No, je to moc pěkný. She was totally immobile, paralyzed. A similar effect in the treatment of obstipation has been achieved in this patient. This lady 3 years ago had a central brain disorder. She was totally immobile, paralyzed too. She could not eat food either. Okay. In August 2017, she had weighed 48 kilo. After half a year of treatment, cannabis, he has excellent blood biochemistry. In May, she had weighed 56 kilo. You can see her status on short video. Please.
Teď.
A ten palec může ruku zvednout.
Palec zvední, tak.
A nohou zase ji odkrytě, jestli může.
Pojď na tu nohu. Zkus tu nohu, to je ono.
She was totally mobile paralyzed.
Vůbec.
A vy nám tam, ještě tam jsou za ní tam a ještě nám tam tu vrkete, že to je super, zvedněte nám tomu palec. Vy jste tam z boku, ať vám máme na kameře.
Jasně, já jsem filmová hvězda.
Mohl byste říct, jaký byl stav předtím?
No, stav byl zoufalý, to jako...
Co znamená
pravou nohou
zoufalý?
nehla vůbec. Pravou rukou špatně, byl to zoufalý, no. Dneska už teda pohne levou nohou, rukou už fajn, rukou už se sama nají, jo,
to je úžasný.
sladný. A jako preparát je...
A s jakou diagnózou je paní?
Červní mozková příhoda.
Dobrý. Stačí.
Dobře, můžeme to zopakovat i...
These first patients had their relatives, of course, and they wanted to be helped with their health problems too. So the database of the patient was increasing, and there was an increasing number of diagnoses that we are working with. Dáme další. We working did two different sorts of impact depending of the sex of patient during the therapy. In the case of women, the growth of new hair occurs and they have a very fine complexion, and the case of men, it is a significant growth of libido. Pustíme další. Next, please. And what our friend animals. Pustíme video. The typical patient with the arthrosis and pain in the small of back is, for example, the breed of Labrador, the aged from 9 to 10 years. The therapy by application of tramadol was chosen, but the effects of the significant obstipation could be seen at the dog during this therapy. The effects of the therapy could be observed after 2 days. The obstipation was removed. After 14 days, the dog moved without the symptoms of backache. I did not inform vet on therapy by cannabis. After 3 weeks of the therapy by cannabis, the vet gave me a phone call. He wanted to know why the therapy suggested by him was not continued. Of course, he called my names immediately that I had jacked the dog. I gave him the explanation of new principle of the therapy. We have been treating approximately 40 dogs and cats since then. I'm informed the professor at veterinary college in Brno on the results of therapy by cannabis preparation. I have been going on cooperating with the veterinary college since 2016. Our patients are iguanas, turtles, snakes, parrots. When recipe created, it depends of veterinary patient to be able to metabolize the carrier of active substances. The cannabis therapy is used, for example, after the operation of these patients. It speeds up the healing of tissues. Jedeme. No. You can see a new X-ray picture of arthrosis of the joint at a dog on slide. You can see arthrosis of the joint after 8 months of application of cannabis preparation on the other picture. According to the vet's comments, the process of the development of arthrosis was slowed down for 80%. Next. The dog in the photo was injured. The first photo we don't show you because were very bad. Large parts of the body were barred with acid. This dog was treated as well as the patient after irradiation. Healing was very fast. Next. 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 It's okay. This dog. Další. Next, please. You can see a bear in zoo on this slide. The bear is 30 years old with the weight of approximately 250 kilograms, strong arthrosis of joints treated by tramadol. When cannabis preparation applied, the bear started to be active regarding the motion after 20 days. It does not have any other medication currently. Next. On this slide, you can see red panda on zoo of the town of Pilsen. This animal was inactive regarding the movement since 2015. There was a strong assertive therapy by tramadol. Red panda starting moving actively and walking after 10 days of therapy by cannabis preparation. After 20 days of therapy, panda climbed the tree in voliere where it had not been more than 1 year. Next, please. We cooperated also with some zoos. On this slide, you can see a large lemur that was nibbling the complexion on its legs. An inflammation arose in the indrogenous areas. It was treated by antibiotics. After the start of therapy with cannabis, lemur stopped demystifying himself after 4 days, and it goes on bladed, not normally. I'm sorry. It does not take any other cures. Next. Stop. This slide displays a typical patient dog. It is 13 years old crossbreed with walking problems and pain in small of back area. Her heartfulness was treated by tramadol. The dog was not able to overcome even 1 stare. The effects of therapy by the cannabis preparation could be seen after 5 days by an increased motion activity. After 14 days, the dog started running to the first floor. It means approximately 20 stairs. The owners stated that the dog had become younger for 5 years. After 30 days, the dog manages to jump on the apron in the height of 80 centimeters from the ground. There was a significant progress in the quality and color of its hair during application of the preparation. Feedback from a patient. This all shows how multi-purpose kind of cannabis is. I hope that for you this lecture was an inspiration for further research on this emerging plant. We still have a lot of work to do, but we are sure expect even more interesting results. Thank you.